Well, Health Minister Zweli Mkhize has said that getting the COVID-19 vaccine will not be compulsory in South Africa, but with just 53% of respondents in a recent poll saying they're willing to get inoculated. Some are asking whether it should be necessary to make the vaccine mandatory. Is there a case for making the COVID-19 vaccine mandatory, as I've just said? So joining us for this conversation, Alberto Giubellini is a senior research fellow on the Oxford Martin Programme on Collective Responsibility for Infectious Disease at Oxford University. Alberto, good evening, and thank you so much for your time tonight on News at Prime. Of course, this is a question that many governments are going to grapple with because ultimately individuals have the right to express whether or not they want to get vaccinated.
Thanks for having me. Yes, individuals have a right to express their views. The problem is that we are in a pandemic, in a state of emergency, and given the data you just gave about the people's unwillingness to vaccinate, so the data you gave is true for South Africa. We have the same situation in many countries, actually. So I think there is a strong ethical case for making COVID-19 vaccination mandatory. First of all, because it might be necessary to have enough vaccine uptake, but secondly, because it's fair. It's fair that everyone, or as many people as possible, make their contribution towards the collective effort of getting out of this situation. It's not just about yourself, it's not about your choice and your health, it's about making your contribution to your community, to get your community back to normality, to a functioning society.
Of course, making it mandatory doesn't deal with some of the fundamental issues that sometimes lead to people not wanting to be vaccinated, not least among which might be that they have concerns about the actual vaccine itself and what its role might be. There's a serious mistrust in the authorities of the day, and I think that those are genuine concerns by people that need to be addressed.
Yeah, I understand that, and that's, again, it's quite a widespread problem, and I understand why certain people have concerns and why certain communities have concern, maybe more than other communities. It's completely understandable. This has to do with a different problem. This has to do with the kind of information we give to people and the kind of trust that people have in science. So I don't think that making it mandatory rules out other initiatives that need to be rolled out. First of all, adequate information. Secondly, I think having some people, those who lead as an example. So I think that the first people to get vaccinated should be, well, the vulnerable, of course, healthcare workers, but actually politicians, scientists, those people who make this decision should be the first to get the vaccine in order to lead as an example. I think we absolutely need to give people information and adequate campaigns about that, fostering trust. This is not incompatible with mandatory vaccination. I think we need to have both. But what you mentioned is a serious problem, is a serious concern that needs to be addressed for sure.
Of course, the other risk that one runs is that should it become mandatory, it might then further flare up the fires, especially of those who believe that it is part of a wider conspiracy and therefore lead to a bigger rebellion against the vaccination rollout or programs altogether.
Yeah, this is quite a common concern that these kind of mandates could backfire. But I don't know, if you think about it, we already been subject to a lot of restrictions by authorities, and that have been enforced whether or not people were willing to comply with them. And we've seen that, for example, restrictive measures keep COVID mortality down. And I think if we do the same with vaccination mandates, you will be able to show people with actual facts how good the effects of vaccines are. And I cannot think of a better way to convince people that vaccines are a good thing than showing with facts that, you see, we have many people vaccinated and it works. So maybe you need to use some level of law enforcement or some restriction or some restrictive measure at the beginning to get the vaccination program going. But then my take is that when people will see with facts that vaccines work and COVID cases will be reduced, I think that will actually enhance people's willingness to vaccinate.
So that means that the process of vaccination itself could well need to be undertaken in a way that has not been done before, that there must be a much more aggressive public I don't want to say performance, but that the public must be able to see the processes of whether it's politicians, whether it's health workers, getting vaccinated, being okay, not suffering from any severe side effects in order to be able to get their buy-in. Is that the way to go here?
Yeah, that's one way to go. But the other way, so I think we need to be clear about what we mean by mandatory vaccination, because when I say mandatory vaccination, there are different ways of understanding this notion. So it's not the case that someone comes into people's houses and vaccinate people with force. That I don't think we should have that. So making it mandatory means that there is some restriction, some limitation of liberty on people who refuse the vaccine. Because if you think, so at the moment, we are all our liberties are already restricted in some way, depending on the country. So, but we are already have our liberty restricted. So vaccination should be seen as the way out of this situation, as the way to get our fundamental liberties back. And one way of making it mandatory is to make this kind of liberty, say liberty to go out, socialize, go to work, conditional upon receiving the vaccine. So it will be a form of mild mandates. You don't force people to be vaccinated, but getting back your liberty, because we are in such an unusual and emergent situation, cannot come for free. People need to make an effort to make their contribution to public health in order to have their liberty back. And the way to do that is as easy as getting vaccine.
Do you think the route of ultimatums will work, given the fact that society is moving and shaping quite differently, perhaps, to what it has ever been before?
Yeah, so it depends, because it depends on how it's implemented. We have examples of other countries where vaccine mandates have worked about other vaccines. So Italy, for example, they introduced a few years ago mandatory vaccination for measles, and it worked. We can try to do the same. Whether it will work or not depends largely on how it is implemented, how it is policed, and what kind of restriction, what kind of penalties there are on failure to vaccinate. Because I wonder what the alternative could be. So you just said that, I think if I remember your data, 53% of people in South Africa would refuse the vaccine. Say half of the population would not vaccinate, more or less. Well, it's not that if you leave it voluntary, you will have that high vaccine uptake anyway. So we also need to think what the alternative is in this situation.
Is there a different way that you think that scientists can also be approaching their own communication with the general population, with communities, to foster greater levels of trust? You know, because again, it seems to come down to the issue of very great levels of mistrust between ordinary people and what they see as the establishment and what the agendas of those with influence, of those in power, may well want to get accomplished.
Yeah, I agree on that. I don't think it's so much about scientists. It's more about policymakers and people who have the authority to decide, for example, which vaccine you're going to get, whether it is mandatory or not. So it is kind of people, like medical authorities, so people making these kind of decisions, that perhaps they need to improve a lot about in terms of communication and maybe in terms also of behavior. For example, one problem we had in this pandemic in the UK, but as far as I can see everywhere, is that we often had like conflicting information about different pandemic measures, about their effectiveness. We had some conflicting information about the vaccine. So this is really something that doesn't help fostering people's trust. So I think we need to improve in that respect. I wouldn't blame scientists. So scientists have done a great job by developing vaccines so quickly and with such a high effectiveness. I would probably put more responsibility on policymakers.
All right, Alberto Giobolini from Oxford University, thanks for your time on News at Prime tonight.